was actually the cape of our founding dean, Dean Irene Palmer, and I thought it was fitting that she be with us here in spirit today.
Hello, I'm Catherine Ferris, and I'm the Graduate Nursing Student Academy Liaison and a PhD student here at the University of San Diego Hahn School of Nursing and Health Sciences, which is adjacent to some exciting new construction, a first-of-its-kind nursing research institute, the Betty and Bob Beister Institute for Nursing Research, Advanced Practice, and Simulation. I'm here today with Dr. Sally Brosz Hardin. She's the Dean of the Hahn School of Nursing and Health Sciences. She's a Fellow of the American Academy of Nursing, and she was recently named the 2014 Healthcare Champion and winner of the Healthcare Educator Award by the San Diego Business Journal. Dean Hardin is one of the great minds and the leaders of nursing and healthcare field, and I asked her to share with all of us today her insights and contributions to nursing and the healthcare field. Welcome, Dean Hardin.
Thanks, Catherine.
Will you please share with us your current title and describe your nursing journey and your career and how you got to your current position?
I got my PhD at the University of Illinois in psychology and communication and my master's degree in psychiatric nursing. And I've been in nursing education and nursing practice a long time. I'm a psychiatric clinical nurse specialist. Won't tell you exactly how long. I
Wonderful.
came to the University of San Diego 12 years ago in 2003, and I had come from initiating, designing, and implementing the first PhD nursing program at the University of Massachusetts Amherst, and then also at the University of Missouri. So one of my colleagues called me and said that this dean's position was open, and I was delighted. I interviewed for it, and here I am.
We're glad you're here. And furthermore, would you please describe your leadership in nursing and healthcare field, specific issues in nursing and healthcare and how you've addressed it and maybe some gaps that you've addressed?
Well, my overall goal was to get and help and encourage nurses to get as much education as possible so that they can practice at the highest level possible. And to have the graduate students at the University of San Diego all eventually go on for their PhD or doctorate in nursing practice. For faculty, I wanted to provide them with all the resources that they would need so that they could also be very productive and function at their highest level. In some ways, I perceive the deanship to be relatively similar to an orchestra conductor, where you find out each individual's positive aspects and try to bring them out as much as possible and form a cohesive, great-sounding group.
So how can you tell me a little bit how this relates to the state and national policies and priorities?
The most important thing, I think, in administration as a dean is to know the most important thing. And before you can affect healthcare policy, you have to have data and evidence to substantiate what would work, what might work, what you might test in the actual political arena. At USD, I knew that we had a highly successful school when I came here. The faculty were outstanding. The students loved the school. We don't even have to publicize the school because word of mouth across the country makes it really great. We have lots of applications for all of our programs. But I thought that what we really needed was to increase our research productivity, because nursing was always too much of a traditional profession and a profession where we practiced by intuition too much. And so that's what we really emphasized. And in the past 5 years, we have quadrupled our research grants, our publications, our presentations. And what's even more important than that, we work in an area that's clinically relevant. We are especially interested in working with vulnerable populations. So we do our research with women and children, especially women during the childbearing period, with veterans and those with post-traumatic stress disorder, with the elderly, with hospice patients. And we feel that these are the areas that we can really do the most good and affect nursing practice and then healthcare policy.
What will be better in nursing and healthcare because of your science and leadership?
Well, I believe in the trickle-down, I guess it's the Hardin trickle-down theory, that the way I treat the faculty is the way they will treat the students, is the way the students will treat patients. And I think I've always tried to be as fair as possible, as transparent in my leadership, and to do that both with faculty, staff, students. I think one of the students asked me the other day, what will be my vision after the Beister Institute for Nursing Research? And I said, the Beister Institute is a wonderful, wonderful stage in our career, but it is not my vision. It holds my vision for very educated, skilled, kind, empathic nurses who do have an effect at the national and at the global levels, and especially with healthcare policy. But to be able to do that, one has to be really skilled individually first.
How do you expect to inform or translate your research into healthcare policy?
We, twice a year, I go to Capitol Hill with all of the deans in Washington, D.C. We try to meet with them individually, with their senior staff, their junior staff, and we present issues. We especially try to encourage them to support Title VIII for nursing education, the National Institute for Nursing Research, to fund that adequately. And we also occasionally can bring our students in the springtime, and students get to be with me and to meet with our Congress people. And we also meet with them at the local level, our council people, our representatives. All the students go to Springfield. We are getting much better at that in nursing, I think, at really meeting with our Congress people, our leadership, and letting them know firsthand what the issues are in nursing, and to let nursing have a voice. At this time, it's really kind of interesting because with the Ebola outbreak, nursing has gotten probably more attention than it's gotten in the past decade. And I don't think that we should be frightening the public about that, because nurses are competent and are trained on how to deal with this. And I don't want to see this issue politicized. I do want to see the nurses get the resources they need to protect the public from acquiring this disease and to take care of those who have it and to not put themselves at risk. But I think that nurses should be depended on more by the media, by politicians to answer these questions. We're a profession that actually will be working directly with these patients. It is nurses who will be taking care of them, and nurses should be listened to about this.
I agree. Very good. Well said. How does your science impact health outcomes? I was thinking of, the veterans and how we've at the University of San Diego have been really helping out with the veteran healthcare system.
Well, about 20% of our student population are military veterans or officers, and we have many duty under instruction officers here. And so I rely on them to help us with pertinent issues with veterans. And also the admiral who is in charge of all Navy nurses came to our school and talked with me and asked for us to please begin a psychiatric nurse practitioner program for all of our returning veterans and to help the nurses out at Balboa, because we are getting more and more patients who are in states of crisis, and the nurses need skilled knowledge and care about how to take care of them. And so we began that program 4 years ago. We also have several of our faculty who are received a grant from the Sense Foundation. They're working with healthcare providers in how to assess patients, all patients who come to see them for whatever problem, and to assess them for potential symptoms of traumatic brain injury or PTSD, and to treat them. And we have several excellent spokespersons for PTSD. In fact, one of our Air Force nurses, who's an alumni, who she herself suffered from PTSD, and now has gone into that field after obtaining her master's degree in psychiatric nursing, and is working with groups of veterans to help them return to a normal, healthy life.
Excellent, excellent. So how does your science impact healthcare systems?
I think that I'm impacting healthcare systems by impacting the University of San Diego Hahn School of Nursing and Health Science, because we have the executive nurse leaders here. Most of the, we provide half of the faculty for Southern California. Most of our alums are deans or directors of nursing programs. They're officers in the military. So the best system that I can affect is this school where all the leaders will go out, and I'm multiplying my effects by working with them and providing the best role model I can possibly be.
Is there other information you'd like to provide regarding your program of research and scholarship?
No, I think that we've covered many of the areas. One of the last projects that we're in right now is we obtained a grant from the Jonas Foundation, and we are working with a group of homeless women. And many of the women who are homeless today have been veterans, and unfortunately many of them have been traumatized in their experience in the military. And so we are working to get pilot data to see, first of all, how to access and reach these women. Will they be involved in the project? And we found that they do. They are coming to meetings, they want to meet with us, and we will continue in that, and we are going to try to determine how best to intervene to help them get housing, safe housing, how to make sure that they don't come back to being homeless, how to help them obtain other resources so that they don't need to be out on the streets, and that's where we're finding them.
So, a lot of words of wisdom and pearls of wisdom from you, Dean Hardin. What advice do you have for the next generation of nursing leaders?
I would say take care of yourself. Realize that nursing as a profession involves lifelong learning. I would highly recommend that you strive to keep nursing as the most honored and trusted profession. This generation is handing off to your generation the top-rated profession that's trusted, and I fear that I don't want nursing to make the same mistake as some other health care professions, which once they obtain power and visibility, that they are no longer trustworthy.
Absolutely. Well, I thank you for sharing your time with us today, to a great mind talking about nursing insights that we will, I know I'm a product of, her vision is very strong at the University of San Diego, and she's very supportive of the PhD students and the DMP students and the MEPN students, all. And her support of the Title VIII programs, the NFLP, I received the NFLP program, so I'm on the NFLP program, and a Jonas Nurse Scholar as well, and I can't say enough about what Dean Hardin has done for nursing, and I hope that you all enjoyed her words of wisdom. Thank you.
Well, you've made my day.
Thank you.